the concept is, how do we pivot to stay in business? I mean, I never thought I'd say that, but 7 years ago, I was looking around and I needed to create a wellness component in my pharmacy to create a cash and carry component. My front end wasn't working as well because my customer count was down and my scripts were down and the margins were down. So this evolved from 7 years ago. And if you can measure it, you can change it. Dr. McCoy, are you on here? I just want to welcome you and appreciate you.
Sure, certainly. Glad to be here. And yes, we are Team Breck. So feel free to reach out and we can give you guys additional information after this short presentation.
Yeah, this is meant to be a 30,000 view because whatever you do, you've got to have multiple streams of non-insurance income. And then Brett has a unique insurance component. But the key to me was, how can we become the health center of our communities? That's what independent pharmacies are. This Nobel Science, what you're looking at is the foundation and what a pulse oximeter does. That's how it measures oxygen concentration. I went to the doctor yesterday. He put a clip on my finger. I was a little low, 98.5. You want to be 99 plus, and it's equal to a blood draw. In 17 years ago, the NIH said we have a number one cause of blindness is macular degeneration in the US, a lack of absorption of lutein, zeaxanthin, astaxanthin, coenzyme Q10, and we need to be able to measure it so we can change it and remeasure it. And they said, let's invent a pulse oximeter that measures these nutrients that come from fruits and vegetables. It's beta carotene, etc. They submitted $2 million to the University of Utah. They invented it. It was huge. It wasn't practical. They shelved it. We came along as a multi-billion-dollar company that I don't work for. I own my own business with. And they spent $29 million in buying the patents because you can't sell the device. It's invented by the NIH. And then we plowed 160-70 million into it the last 17 years. So when I saw this 7 years ago, I was curious about what is this? And so the light that bounces into the oxygen molecule to measure concentration equal to a blood draw is red. This is blue. So this blue bounces into a double bonded conjugated linear molecule that could be coenzyme Q10, beta carotene, lutein, zeaxanthin, astaxanthin, comes from spinach and carrots and vegetables, all those things that we don't eat anymore. And that is peer-reviewed clinical, Stanford University, Yale School of Medicine. I've got peer-reviewed studies. But when I saw and heard of this, I wanted to find out more because I wanted my wellness section to be clinical. I wanted my pharmacy to be differentiating because this device is not for sale. I'd never heard of it. You haven't. But I didn't know how to monetize the wellness component. That was my problem. And so here you see that we've created and have 44 global patents with this device that is not for sale. I rent it for $140 a month. You get to use it, no strings attached. But look at this. I got an 8-year clinical study from Yale University, Stanford, Texas Tech, and this goes on and on. And here's an abstract about the use of it. So Gellerman was one of the people that invented this device at the University of Utah 17 years ago. And this abstract is actually the patent on it that was written by the NIH. So it's a rapid way of determining the carotenoids, which are antioxidant level, that provide diagnostic information regarding wellness. Well, isn't that what we're doing today? Isn't that why people are buying zinc and D3 and so forth?
Absolutely.
So, Dr. McCoy, and you got to realize I'm just giving you a taste of what I became curious about and then integrated and then developed a considerable income stream with. If you can measure it, you can change it and you can monetize it, right? Dr. McCoy, you've been working with pharmacists, owners across the nation like I have.
Yes, absolutely. I just did an event this past Saturday, so.
So the key here is we all know the bone density meds came after the bone density scanners were in. We all know the importance of glucose measurement. So the testing provides a basis for the expansion of the solution, and then the retesting creates retention. How could I do that in my pharmacy? How could I make sure that everybody that came in that got a statin got tested so I could show them their low levels? Because the matrix of antioxidants, one of the main one is coenzyme Q10, and they all work together. So the antioxidant measurement tester, you put your hand on it instead of putting your finger in the clip, rang a bell. And so I wanted to find out, is it clinical? Is it peer reviewed? Is it legitimate? Is it equal to a blood draw? All the questions got answered, yes, 7 years ago. And so I rented it and brought it in. And this pile of vegetables is what we're measuring. Now, this can also be in a product line of a supplement, not the Nature Made that Bergen or McKesson or Cardinal were selling me, but they're all garbage and don't get absorbed. I had no idea. But this device was my bridge of education from allopathic into functional integrative, because I knew it was important because of the enteral parental work I did in my infusion company, but I didn't know benchmarking. I didn't understand how to monetize it in my retail pharmacy. And so as I sought to bring a wellness component, I started using this tester. It readout is on an iPad and a medical app we control, and CVS can't have it. Walgreens can't have it. It's not for sale. You can't go buy it. So it's only in the DOs, MDs, the healthcare practitioners that are part of this network of healthcare providers. And there are about 2,000 in the US. There's a few hundred in Canada. I have some in Mexico. They're a unique niche within a niche, and it's not associated with a particular brand of product lines. But of course, if you're talking about the company that spent 160, 70 million, they have 90 PhDs on staff, not consultants, and they are focused and have product line that are in the PDR, for instance, because they're all clinical. So as I begin to explore this, which I'd love to share more, and so with Dr. McCoy, it's about measurement. And this was key. This is how I started. These numbers are quadrupled today, but 7 years ago, I tested, I recommended a product line. Many of the pharmacists or the DOs I work with have multiple product lines, but the tester doesn't care about the product line. It's like the pulse oximeter doesn't care if the oxygen comes from a tank or a concentrator. I used to own 150 concentrators at one time. It doesn't care. What it cares about is the presence, just like the 98, 99, 95%. This measures the levels, and we've got all the clinicals, microgram per deciliters. So when I heard about this, I then checked it out. I studied the clinicals. So my first year, I made about 78,000. Now that's profit, cash, not dependent on anybody else, because I would always have them come back for a follow-up test in 6 to 8 weeks. Most important thing. And these are some of our pharmacies that we've got across the nation utilizing this. This lady's in Fresno. This guy's in Albuquerque. This is Florida. There you are, Dr. McCoy.
Yeah, that's the event I just did on Saturday in North Carolina, in Durham, North Carolina.
So as everybody's looking for what do, we have the answer, the teaching, the mentoring, and the integration, because it's not about renting a scanner. It's about how do you integrate it to create a difference. So real quick, I want to jump off, but I want you to go away realizing that we measure those rainbow. Those, and if you can get those, you can also get those in a supplement. You can also use omega-3s. But the key here is we have to be able to measure these rainbows, and the amount of antioxidants you maintain in your body is directly proportional to how long and healthy you will live. Dr. Richard Cutler, NIH. I've got to jump off. Dr. McCoy will stick with you a bit, but we're not here to dig down into the weeds. We want to give you an overview taste of you can make a difference not only in better patient outcomes, but pharmacy income, clinic income, and we teach, mentor, and train that. So thank you. Thank you for your time.
A great opportunity of bringing in a cash opportunity by showing what the deficiencies are, and it fits right into the whole wellness solution of what we're going to talk about today. When you take in patients and can identify some of the deficiencies and then have an immediate answer for them, and with products that are quality products. So this is a part of that cash pay, but it does also, we're going to include it into the insurance side of it as well too. So
thank you, Breck. I'm here for anybody to answer questions, talk to. Breck's got my phone. Dr. McCoy's got my phone. Thank you.
Okay, excellent. Appreciate that. All right, let me back up the presentation. Will, if you wouldn't mind taking just a minute and just giving an overview of some of the differentiators in doing billing through ServeRx. Appreciate it.
Absolutely. So this is another opportunity for pharmacies to make some more revenue. We know workman's comp is a small percentage of pharmacy's business, but when adjudicating workman's comp claims through ServeRx, the pharmacy can receive the profit that they legally deserve. And you can see here, for example, we take a meloxicam. Again, this is a free service for the pharmacy as well, so there's no enrollment fees, no annual fees, no monthly fees, just added value benefit for the pharmacy. You take a look at our chart right here, you see a meloxicam. If a pharmacy was to adjudicate a meloxicam to a PBM, the pharmacy may be reimbursed $4 to $5 for that medicine. But now if that pharmacy was to adjudicate that meloxicam through ServeRx's NPCN, the pharmacy could receive anywhere from $91 to $101. And I know a lot of pharmacists say, well, how is that possible? ServeRx here, we reimburse the pharmacy of AWP. So for brand medications, we reimburse the pharmacy 85% dollar dispense fee, and for generic medications, we reimburse the pharmacy 70% dollar dispense fee. And that will be reimbursed to the pharmacy if you are with a PSAO in 30 days. And if you are an independent pharmacy, the pharmacy will be reimbursed for 45 days directly from ServeRx. We do the legwork for the pharmacy, so you never have to worry about contacting the adjuster, the insurance company, etc. If it ever leads to that, ServeRx has a whole team that will reach out to the adjusters and find additional information that the pharmacy needs for that patient to be successfully transmitted to ServeRx. ServeRx just is here to help work out of workman's comp and keep those fair reimbursements in the pharmacy that you legally deserve.
Awesome. Thanks, Will. Appreciate that. So again, if you're not utilizing ServeRx, we encourage you to please get enrolled. It doesn't cost you anything. In fact, it actually costs you about $50, $60 per transaction if you don't use ServeRx, because that's how much actually the PBM putting closer to $80 to $100 in their own pocket every time you process through the PBM for workers' comp. So other third-party opportunities, if you're not involved with auto, if you're in states that have good auto, like New Jersey, Michigan, other states that have good auto programs, go direct. Don't go through the PBM with that. You can do that through Bridgeport. They're similar to us, where they're completely independent, no affiliation to PBM or no affiliation to the mail order. That's the other big thing too, Will, that we sometimes forget to really highlight is, even if you're happy with a certain PBM contract that you have, their ultimate goal is to literally poach that patient. They want to put them on their mail order program, because then their margin increases to $120, $130 claim by taking them out of your pharmacy and having them get mail order prescriptions. So we'll never do that to you. Bridgeport won't ever do that to you either. PI is another area. And then there's more popular, more and more pharmacies are just adopting a cash pay price with their, and just completely going out of network and just letting patients know, hey, your cash price is probably equivalent or even less than your copay for the medication. And so then they can cancel some of those PBM contracts. You are community pharmacies that are serving a community. Get involved with that community. Be a part of the city. Let them know that you could provide a complete employee program for them. Used to just be pharmacy benefits for workers' compensation, but we can now expand that even into their commercial or health plans and save those employers, those self-insured employers in those cities and county governments about 30% if they go direct with their community pharmacy right there in their own backyard. We can help you with that whole process. We can get involved with the RFP, the request for proposal. So find out when the next request for proposal is for your own city, and we'll help you put in for that and hopefully win that bid and become their community pharmacy, which they should be keeping those dollars local anyway. Thank you all for being here. It's been a pleasure, and have a great rest of your week. Thank you all. Bye now.